Hello, good morning, everyone. Myself, audiologist Himanshu Sanju. Today, we will talk about central auditory processing disorder. So, I want to tell you something about central auditory nervous system. So, whatever we hear, actually, we process at the level of central auditory nervous system. Many times, children or adults may have some pathology in central auditory nervous system. Because of that, they may have problem in understanding a speech, especially in noisy situations. So many times, children may have normal hearing. Instead, they may find problem in understanding a speech, and they may ask for repetitions. So in that case, one should consult an audiologist for the diagnosis and treatment of central auditory processing disorder. So let's talk let's describe these all these let's describe this particular disorder. So whatever we hear, we actually process it at the level of central auditory nervous system. So there are different processes which helps us in understanding speech. In one can say in the noisy situations or in the competing signals. Like there are different processes like temporal resolution, binaural integration, binaural interaction, binaural separation, monaural low redundancy. So all these processes helps us while understanding speech in noisy situations. So many times children who have or adults who have pathology in central auditory nervous system may have trouble in understanding speech even though they have normal hearing. So basically when we talk about central auditory processing disorder, we are more concerned to our children, because if a child has central auditory processing disorder, they may have problem in academic activities. So it's very important to identify the kids with central auditory processing disorder and diagnose and later treat as early as possible, which lead to make them a proper to help them in academic uh, abilities. So these children may find a lot of trouble in academic activities, like especially in schools, because like in a normal like a classroom situation, there is a lot of noise, and in that case, they may have trouble in understanding a speech in noisy situations. So let's see the sign and symptoms of central auditory processing disorder. So when we talk about the sign and symptom of central auditory processing disorder, these children may have problem in understanding speech in noisy situations, as I already told you. They may have problem in understanding in a competing signal. They may have poor academic background. They may have problem in reading and writing. They may have problem in listening music. They may have problem in understanding some kind of sarcasm. They may have problem in understanding jokes. So because of all these issues, they may have problem in academic activities. So these children, in spite of having a normal hearing, may fail to in spite of having normal hearing, they may fail to grasp the classroom activities. So in that case, if a teacher, suppose there is a class teacher or someone who is teaching in the classroom, and if they find a children who actually are not performing so well in class, they may send that kid to an audiologist, and there are many questionnaire which is available. They can administer those questionnaire on kids, and they can identify the children with central auditory processing disorder. So let's talk about the prevalence of CAPD. So according to Mosaic, the prevalence is 2 to 3%. Like in a classroom of a strength of some 50 kids, one or two children may have problem of central auditory processing disorder. So in that case, the parent as well as teachers should not ignore it. They should identify it, and as soon as they identify it, they should send or recommend a child to an audiologist. And now let's talk the role of an audiologist. So what audiologists do? Audiologists first assess their hearing. Definitely, if the child has CAPD, their hearing must be normal. Afterward, the audiologist will take a detailed case history, and the audiologist will also do a series of tests to identify the exact pathology. They will identify the exact process which is not happening properly in that kid. As I already told you, like there are different processes like temporal resolution, monaural row redundancy, binaural interaction, binaural integration, binaural separation, etc. So the audiologist will run a series of tests to identify the problem, the exact process which is not working properly. And after the identification of the problem, the audiologist will also help the child in the treatment. The audiologist will help you, like there are different treatment procedures, like we give different different training programs. We have different training program for children with central auditory processing disorder. So that we do, and we try to treat children with central auditory processing disorder. I have published a couple of articles on this particular issue long back. So in the description of this video, I will send a link of the PDF from where you can download the PDF and you can read it. It's for parents, and as well as it's also for the teachers. So thank you. I hope you must have some information regarding CAPD now. And so as soon as you see some children with CAPD, or you feel that this child may have CAPD sign and symptom, in that case, don't delay. Just refer to an audiologist. Okay, thanks a lot.